My name is Kevin DeMarco. I'm the CEO and co-founder of RIF Robotics. I knew from a pretty early age that I wanted to go into something where I was building things. My grandfather ran a paper mill in the early 20th century. I don't think he had a full 4-year degree as a mechanical engineer, but he was basically designing new machines. And growing up, I would play in his basement and take motors apart and learn how electricity works as a kid. And then with the healthcare side, my mom was a nurse, my aunt was a nurse, I had uncles a nurse, another uncle was a pharmacist. So I kind of grew up in a family of people that always worked in hospitals, and this kind of interesting mix of providing patient care, but also then the complex management of hospitals and logistics around it, and how those get in the way of actually providing patient care sometimes. And so, as I got old, I was doing robotics, but then as I saw that some of the robotics technology that was being developed could be applied to solving these logistics problems in hospitals in a real way and not just a theoretical way anymore, that's what really got me into wanting to doing a robotics healthcare business. We founded the company at the end of 2020, and we worked with the VA to sort of outline these various problems they were seeing in their hospitals around sterile processing. And out of that came the specific product we're building, which is a robotic system that inspects and assembles surgical trays and equipment. The dream for us for RIF is that we kind of build the hospital of the future with automated robotics, logistics, computer vision, and AI that helps nurses and doctors focus on patient care and less around logistics of operating the hospital. A long-term vision is making the Amazon robotics of hospitals, where basically people can concentrate on what they're best at. And developing these new kind of technologies is just really satisfying for me to see them be efficient and help people do a better job and help patients recover quicker. I would say over the last few years, as first-time founders, it's taken us a long time to get traction and have other investors and other companies take us seriously, because we are first-time founders, and I think that makes it pretty hard. But in the last year and a half, we've had companies like major global companies. We've got a partnership with Mitsubishi Electric now that provides a lot of our robotic arms and hardware, and it's really helpful to us. We've got investors taking us seriously. We've got other large companies that provide medical devices that are always reaching out to us to figure out how they're going to work with us in the future, because they know that we're going to come in and kind of disrupt their way of doing business. So I see that as a major accomplishment right now. One of the reasons, talking about building trust and getting credibility, working with catalysts has helped us refine our business value proposition. It's also helped validate the problem to other investors who don't understand healthcare as deeply as the people in Catalyst do. And that kind of validation early on really helps, because if something was obvious, it would be done already. But because Catalysts are in healthcare and understand it, they've helped demonstrate to other investors and other companies that this is a valuable company that we're building. What gives me inspiration is building new products with new technology, with new mathematical ideas, and bringing them to fruition in the real world. Robots are really fun, and I like to play with them, and I like to write software that controls them.